You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments with a few dental implants. With us, we have an expert on the topic, Dr. Haque. Dr. Haque, welcome to the program.
Thank you. I'm excited to be here, Randy.
Good. Now before we get into today's topic, and you brought some pretty dramatic photos, so those will be good, and some models, and we'll get to those. Now, I understand you do more than dental implants, so for people that don't know you, who's a typical patient that you see? I mean, what do you spend your day doing?
Randy, we have a full spectrum of patients that come to our office, all the way from fillings to whitening to veneers to crowns to implants. We do crowns in a day in our office with the E4D.
Right there?
Right there.
Is that true when I hear same-day crowns?
Absolutely. You know,
Okay.
Back in the day, we used to do crowns over multiple visits. We would have them come in, we'd take an impression after doing the work on the tooth, send it to the lab, have the patient in a temporary crown for a while, 2 weeks later come back, take this temporary crown off, have to numb them again sometimes, and then cement the crown in. It was a pain. There were a lot of different issues that would come up as well. When you take an impression, there's distortion that can occur. When you take an impression with the E4D, which is a laser that takes the impression, it's all digital.
It's like a camera in their mouth, is that right?
It is. It's like a camera and an ability to survey the entire area three-dimensionally, allowing us to get a very, very precise, basically a precise
Like a couple hours? How long does it take to make that crown?
Start to finish about an hour and a half.
Do people actually wait to
They
get it done?
do. They do. They usually bring a book or a movie, but it's usually about 20 minutes of downtime.
People don't like going to the dentist, right?
Nobody likes going
Do
to the
they
dentist.
say that to you?
Every single one of my patients tells me that, Randy.
And what do you say to that? You must have a comeback, right?
Well, I'll ask them what makes them not like going to the dentist, and I find out what's going on. You know, a lot of the patients have fears from when they were children. Some patients have stories that their friends and family have told them. But we try and make it as comfortable as possible for them.
Do you convert them? I mean, do you have people, do you take that as a challenge? Like you go, they're going to like us when it's all done.
Randy, there's so many patients that come in and they tell me straight up, I'm scared as heck. And oftentimes we'll give them the options of sedation or nitrous oxide to put them at ease, which is laughing gas. And more times than not, after 1 to 2 visits, they're just doing it the old-fashioned way in our office, which is just the local anesthetic.
I flipped through your book. I read probably 85% of this book.
Cool.
In fact, he wrote Dental 101, 101 factors you should know before going to the dentist. Why'd you write the book?
Well, I was inspired to write the book based upon a lot of the questions patients ask me.
Okay.
And I get a lot of the same questions again and again and again. And I wanted to put it down on paper.
So you give this to patients?
I do.
Good.
I do. I give it out to
Does
patients.
anybody read it?
A lot of them do. I hope they do.
Well, I read it. And it made me almost kind of afraid to go to anybody else, right? So I got to get on a plane and go to you, but hopefully I won't have to, right? So good for you. It's a good book. So at the top of the show, we said no more dentures.
No more.
Get a fixed set of teeth in just a few appointments. How big of how many people are wearing dentures?
Randy,
How big of a problem is it, I should say?
well, the average American, by the time they're 80 years old, is missing 10 or more teeth.
Is that right?
Absolutely. The facts show that most denture wearers don't go to the dentist anymore. And those that do have dentures don't know their options. It's an amazing thing.
Would you say
Randy,
like there's thousands in your neighborhood or thousands in the...
I think there's tens of thousands in our neighborhood. I do. I think there's lots of people out there.
So you're saying though that with just a couple of dental implants, they could get a full arch of teeth that snap in, snap out. I mean, that's the whole no more denture thing. Or a fixed set of teeth with 4.
And that's one of the things, Randy. There's multiple options for those denture wearers out there. They can get their denture much more secured with a couple of implants.
Is that the future of dentistry?
That
You think
sure is.
The dentures will always be secured to something?
I think the future is here right now.
Okay.
But we just need to ask our patients if they want it. The big thing that happens with denture wearers is many of them are so frustrated. Some of them are miserable
Is that right?
with their teeth. They can't chew. Some of them click when they talk. Some of them have denture adhesive that they have to put in every day. I've got so many patients with so many different stories, with frustrations nonstop about their implants.
So why is it what used to take like 6 months or 9 months or whatever can now happen very quickly? Like you say, teeth in a day.
Absolutely.
What's changed?
The biggest change, I think, is imaging. Because of the fact that we can actually look at things, decide exactly where those implants are going to go, decide whether or not the patient's a good candidate for it.
Okay.
It's fantastic what we can do with imaging. It's all three-dimensional. It's all graphics-based. It's spectacular, the images that we get. But the other big change is the technology of the implants themselves. They used to be a lot smoother. Now they have ridges on them. They have a good bite when they go in.
So the bone grabs onto them quickly?
Much more quickly. The surfaces that are used today in dental implants have improved dramatically. There's a lot of research that's being done on them.
So when I hear, though, that, doing research where somebody without teeth could go in same day, get a tooth, get a crown on top, and walk out, that's true?
It is true. Randy, there are a lot of cases where that's available, but I will tell you, though, Randy, it requires proper diagnosis before we jump in and do that.
You say that, for the denture wearers, that you do it a little bit different as far as the surgical procedure or the whole process. Elaborate on that.
Back when I started doing dental implants or started working with them, I used to send my patients over to a periodontist or an oral surgeon to get the implant placed. Okay. I'd wait some more. 3 to 6 months later, they'd come back to me. I'd take a look. They'd go back to the oral surgeon. It was a lot of back and forth.
Because you're the guy that puts the crown on top, the tooth.
That's what I used to do initially.
So the surgeon does that, put the crown on top, and then they go somewhere else for the imaging.
Exactly.
Okay.
Exactly. And that's the way
it's
done.
So you do all
most,
that, though?
We do it all in our office now. And it's so much easier for the patient. It's all coordinated in one office. And the big difference is I begin with the end in mind.
What does that mean?
Randy, we want to create a beautiful smile.
Okay.
And if we place that implant in the spot that works properly, the actual tooth that goes over that implant can be placed the right way, at the right angle, with the right symmetry in relationship to the rest of the teeth.
Okay, good. Okay, so what are the categories of dental implant patients that you see, if you had to categorize them?
Okay. Randy, we have patients that, the first category really is single tooth.
Okay.
If they're missing one tooth, that's one category. The next category is people that are missing 3 to 4 teeth. The other category is the people that have been told that they need to get their teeth out, and they either need to get dentures or dental implants.
Okay.
The next category after that are those denture wearers that have had dentures for 20 plus years. And they're frustrated. They're annoyed by their dentures, and they want something that's going to help stabilize them. And then there's those folks that just recently got dentures, and they're so annoyed by them, and they want something better.
But isn't it true, though, like for the people that have been wearing dentures a long, long time? My mother, at 74, even her medical doctor said, because I told her, look, I'm interviewing some of these guys, and she said, my medical doctor said I'm too old. Not enough bone. They'll fall out. What is your response to that? I mean, isn't it true, though, some people, especially after that long period of time, can't get this?
Randy, I have a lot of patients that come to my office that have been told by others they can't get implants. And oftentimes they don't have the right data to make that decision.
You mean the dentists don't have enough data?
Many times.
Okay.
If you don't have a CT scan, you really can't visualize that bone. You can't see it.
Okay.
And that's a big frustration as well, because without the right technology, you can't really make a good decision.
So are there patients out there that are told you don't have enough bone, you can't get dental implants, that actually can?
Absolutely. We've had a number of them.
Have you ever had to turn anybody away?
I've yet to turn anyone away.
So most people are candidates.
Absolutely.
I mean, obviously, if you have what? Diseases or uncontrolled diabetes?
There's a number of diseases that we watch out for. Uncontrolled diabetes being one of them. Very heavy smokers are less of candidates. But most people, we try and help work with them. We work in conjunction with their physician to make sure that they get under control.
So within an hour of your practice, if tens of thousands of people have an upper or lower denture, if it's so good, why aren't they all doing it? Why aren't they all coming in for 2 implants, for a fixed set of, or a set of teeth that snap in, snap out, or a fixed set of teeth?
Randy, I think...
Why aren't they doing it? What's your take?
I think the biggest take is because of the fact that they haven't been to a dentist for a long time.
Okay.
Many of those denture wearers have had dentures for X number of years, and they don't know their options. You know, dental implants didn't exist 25 plus years ago, at least not in the mainstream. Another reason is because of the fact that they're afraid of pain. And that is something
It does seem painful.
You know,
I mean, no doubt about it.
Randy, just like when you get your nails cut or you get your hair cut, bone doesn't hurt when it gets cut.
Interesting.
Yes.
Okay.
Now, the gums are a different story, but we try and alleviate that discomfort by doing things a certain way. You know, when we get a guide made, for example, we can decrease the trauma dramatically, decrease the need to what the old way was when you took a tooth out, or when you wanted to place an implant, you'd have to make a big flap in the gum, move it all out of the way.
There were stitches in the old days?
Lots of stitches.
Not
Lots
now?
of stitches. Not as
Very
much.
rare?
In some cases, I'm doing these procedures with almost no blood. It's unreal.
Okay.
It's unreal. You know, it's fascinating.
Okay, so their fear of pain with these dentures is keeping them from coming in. You say they don't go to the dentist. That's a very good point. So nobody's telling them to do it, is your take.
Absolutely.
And I guess by the time you become a denture wearer, like my father, the last thing you want to do is go to a dentist again. Is that right?
You know, they've been frustrated with their dentures. They've been annoyed. They don't feel like there's any solutions out there. And my job is to find out what's going on and give them options.
So
to
do you
help
think
change
if they knew the benefits, I mean, do you believe this in your heart, I guess, that if these thousands of denture wearers knew how easy it was, let's say, that they would all do it?
I think they would.
Because you find, now we should mention, I guess insurance does not cover this, Medicare doesn't cover this, but that's throughout the US and Canada. But you have financing and you do what you can. You even offer mini implants to make it affordable.
Absolutely. There's options out there. We
Okay.
try and work with our patients to find an option that works for them.
And because is it less to go to a guy like you because you do all of the procedures and have the CT or the imaging center right there? Could it be?
Well, I think it should be. You know, they're coming to one place. They have less visits. We try and do it all in one place in order to...
You say it's changing people's lives, okay? And I'm skeptical. I always think, well, you know, you're a dentist. Of course, you think teeth are important. You brought some photos.
I did.
And then I looked at your photos, and pretty impressive. And people are watching this. So why don't you show some of the photos for the sake of time here?
Sure. Let's start off with this gentleman here. Now, Randy, take a look at this gentleman.
Okay.
He came to my office. I asked him to just smile for me.
Okay.
And that's the best he could do. He was absolutely miserable. So his daughter forced him to come in because he just wasn't getting the results he needed. He kept going back to the dentist every 3 to 6 months to redo his fillings, to redo a crown, and he
Is
just
that
was
common, by the way?
so common. I can't tell you how many patients I see like that
Interesting. Okay.
on a regular basis. This patient in general,
So the daughter forces him to go in.
she forced him to come in. She wanted me to take a look at him and see what options I could
What did he
present
say?
to
What
him.
did he say?
He said to me, Dr. Haque, I can't eat steak anymore. It hurts when I chew. My upper denture, it's flopping around. I
Okay.
hate it. What can you do for me? So we went through our protocol in our office. Took x-rays, took photos, took some impressions, and sat down and talked to him about his options. And
Like, do you get excited, by the way, when you see this? Because I think you told me that in the green room.
I did.
Like where you go, this is going to be good.
You know, when I saw him come in, I immediately had an idea of where I was going to go.
Okay.
I did. I was excited. I saw him. I said, "Oh my
Okay.
goodness, this is amazing. This is
right.
amazing. We can transform this person." Randy, I want you to take a look at him. I want you to
Okay.
take a look at his picture
Yeah.
again.
Yeah.
Take a look at him when he's smiling at the beginning.
Yeah.
He looks.
Like an older guy.
He's an older guy. He was a senior citizen, great guy. He served our Navy with
Okay.
pride. But he was absolutely miserable. 10 years he was going through this.
Okay.
And he wanted some answers. Look at him, Randy. What do you think?
Well, he's looking like an older guy.
I want you to see him, what he looked like at the end. You know,
Wow.
he just completely transformed.
So what is that? What did you do for him?
For him, we did implants on the upper and lower, and we put him into fixed teeth
Okay.
that he doesn't have to take out. No more denture adhesive, no more pain. He was so ecstatic after he was done.
So it's a full arch of upper, full on the lower.
Absolutely. 4 upper
Interesting.
implants, 4 lower implants, and then the actual prosthetic or the teeth anchored to those
Okay.
for good.
What could he eat? And how soon could he eat?
You know, there is a small waiting period after you're done where you can't chew heavy things.
Okay.
But after that, he told me it was the first time in his life that he enjoyed steak so much. But it had been 10 years since he ate steak.
Is that right?
Randy, look at him now. After he's done with that, he could be a poster child for any senior citizen community.
Yeah. He looks good. There's no doubt about it. Is he a typical patient?
He is.
Like there's a lot of people.
Randy, we see a lot of patients like that, but we want to see more of them.
Okay.
Patients that are frustrated, they've been going through a lot of different scenarios. They still have a lot of infection in their mouth. They've been told they need to get their teeth out, and they're just hanging on.
Do they
I don't
really?
know why.
Okay.
I don't know why. But they just can't get rid of that idea. But until they get that infection out of their mouth, until they get that bacteria out of their mouth, and they
So the gums get healthy when you remove these bad teeth?
Once you get those bad teeth out, the gums get healthy, they heal beautifully, and that's where they're perfect candidates for implants.
So this is, now what's the oldest patient that could get this done?
I had one patient that was in their 90s that had implants done,
right?
but the majority of my patients are younger.
Isn't that riskier where they'll fall out if they're 90 plus?
No, bone is bone. Bone is bone.
Interesting, okay.
It's basically all about diagnosing it the right way, looking at the case, making sure their medical history is all right, but bone is bone.
So no more dentures. So this guy, what's his life like after that? So every 6 months goes to the dentist, or he never goes to the dentist, or what's the story?
We still just have to keep him clean.
Okay.
That's all.
So how does he take care of those? What's the maintenance?
So at home, it's just like regular teeth. You brush them just like regular teeth, and still come back every 6 months so we can take a look and make sure everything's looking all right.
Okay, and the only way they could come out is with the dentist. Is that right?
That's right.
Because it's a fixed set of teeth?
It's fixed.
Interesting.
No other way
It
to
seems
take
like
them out.
everybody would want that.
Why not?
Okay.
Why not?
Okay.
But I have an amazing case I wanted to show you. Randy, this was a patient. She came in. She's 38 years old.
Wow.
She works in sales for a living. She was embarrassed about her smile. She didn't ever smile. You know, if you take a look at that one photo, Randy, that's her smiling. It looks more like a grimace.
Yeah.
It's
Just because she doesn't smile.
She doesn't smile. Her big complaint was she told me that her coworkers thought she was upset all the time, even when she wasn't.
Because she wasn't smiling?
She wouldn't smile all the way. And even her smile, it does
So
look
that's
like
her smile.
That's her smile.
Interesting, okay.
It is. But when we took a look, we realized those teeth had to go. We had to take those out, and we had to put something else in. So her options were dentures or implants.
Okay.
And she decided to go with a set of teeth that snapped in, locked into her mouth,
Okay.
and created a gorgeous result. I mean, if you take a look at her after we were done,
That's the same woman?
that is the same woman. It's not just teeth, Randy.
Okay, good.
It really isn't. I mean, it
Okay, good
changed
for
her
you.
face. It changed
I mean,
everything.
that's a
about
sexy
her.
smile, by the way.
It's good. I love it.
I mean, it's a totally different. So her coworkers thought she was mean and angry and depressed or whatever, you said.
Absolutely.
Do you know the follow-up on this story?
I do. I know that her sales have doubled over the last year. I know that she's done extremely well. She already had a wonderful husband and kids, but she's just so much more vibrant. She's friends with me on Facebook now. And I'll tell you, the photos I see of her before I did them, because I didn't know her as well before, the photos of her before, she looked upset in all of her photos. And now she just looks so excited and energetic and young.
And she can eat whatever she wants.
Absolutely.
Now, when it's all done, because this is such a dramatic before and after, is it like emotional when she sees herself in the mirror, or?
You know, she was one of those that was crying the day that she got them happy tears.
Yeah.
And it was really moving to all of us in the office. It was one of those happy days.
Well, 'cause I can't believe people are wearing dentures in their 40s.
Randy, I know it's hard to believe, but there's so many people out there that are 70, 80 years old that are still dating. They want to get out there.
And they don't want dentures.
They don't want dentures.
Okay.
They want to be able to kiss.
So is it men and women that are doing this? Combination of both?
It's all of the above. It is. Men, women. I do see that men are less likely to come to the dentist than women. Studies have proven that.
We wait till the
I
last
see it in
minute.
my own office too.
Well, nobody wants to go
All
to the
time,
dentist.
all the time. Women are a little more proactive
Okay.
than men in some cases, and men usually wait till the last minute, till it really hurts, till they're so frustrated. But women tend to take care of things a little more, but some of them have fears as well.
Okay.
You know, I'll tell you, I have one woman, she was only 24 years old, and that's the way she looked right there.
That's got to be unusual. Interesting.
She didn't know what to do. She had no idea.
Are there a lot of people like this out there?
There's a lot of people out there. You don't see it because they keep their lips around their teeth.
Interesting.
You know, it's a funny thing, but it's happening.
So
to a
what
lot
are her
more people.
options? So those teeth are just what? They have to be
Those
extracted
are,
or pulled out or
They
whatever?
do. They have to be pulled out. There's no real way to save any of those teeth.
So what did you do for her?
In her case, she did not want dentures. I mean, she's so young. She wanted teeth that she could brush and floss just like real teeth. And so for her, we did implants all around the mouth.
Oh my goodness. It's like a model smile. I mean, that's a beautiful smile.
It's absolutely.
But that's like in a way, kind of a denture, right? Or no?
No, this is not a denture. These are actually porcelain crowns.
So it's like a fixed set of teeth.
Fixed set of teeth. It's absolutely stunning. The results you can get with porcelains.
So it's like veneers.
It is. It's similar to veneers.
Okay.
It sure is. Sure is. But they go on implants.
I mean, that's a huge difference, by the way. I'm not trying to side with you here. I think anybody looking at this knows that, because I always feel like I could spot veneers even, and these look really natural.
Those are.
What does she say when it's all done?
She sent a bouquet of flowers the next week. She told me that her husband kissed her for the first time in 3 years.
Interesting. Well, that's nice.
It was fantastic. There used to be a really bad smell that came from the mouth. She was embarrassed about it. So she, in fact, was the one that didn't want to kiss him as much as him. She was embarrassed about it. And that changed everything.
So no more dentures. Okay, good.
This patient right here, Randy, came in with a broken flipper. He had 4 missing.
What's a flipper?
A flipper is like a temporary mini denture.
Okay.
It's for a few missing teeth, or 1 missing tooth. Okay. And in his case, it was for 4 missing teeth in the front of the mouth. And the reason it's called a flipper is because you can flip it in and out with your tongue, usually. And his flipper broke. And he wanted something in there, but he didn't want that flipper anymore. He was tired of it. He was tired of it moving around when he talked. It would click on occasion when he said certain words, and he was annoyed by it. He wanted some fixed teeth. So what we did was, in his case, we did 2 implants. He had great bone. He had been told by his first dentist, by the way, that you can't get implants because you've been missing those teeth for too long. It's not.
Does that bother you, by the way?
All the time. Yes.
Because I know you want to be positive on the show, but it does frustrate you.
Yes, it does frustrate me.
Because people have been told out there you don't have enough bone, and because of advances and your training, they're candidates.
His dentist told him to do a 6-unit bridge, which would mean grinding down those 2 canines, which are perfectly all right. There was no need to grind down 2 good teeth. And he wanted other options. And that's what you can't do.
So these don't come in and out. Very nice.
Let me show you just a couple more.
Okay. Time for probably one more, but go ahead.
Okay. So this patient, she came in. She had an upper denture. She had lower front teeth remaining. And they were in good shape. But her big concern was she hated taking out her denture when she would go to a hotel. Because more times than not, the sink is outside of the bathroom. And she didn't want to take it out in front of her husband. So she would take out her denture when she took a shower.
Okay.
And she didn't want to do that anymore. And she wanted fixed teeth. She wanted something that was permanent in her mouth. And so for her case, we did some implants on the lower back, and we did implants all around the front on the upper, and gave her porcelain teeth on the upper jaw.
Fixed set of teeth.
Fixed set of teeth. Absolutely stunning results. You know, one of my other concerns that I have sometimes is some dentists think that there's only one solution for everyone.
Okay.
And they're fantastic dentists, don't get me wrong. They are excellent at what they do. But there are other options out there. There are better options than sometimes even doing 4 implants or 6 implants. There are better options based upon that person's needs and wants.
Okay.
And it's important to find that out.
And we are out of time. You brought models.
Yes.
And these are options for denture wear. So if a denture wearer is watching this, this is, I guess, important.
Absolutely.
And you show this to patients.
I sure do.
Okay.
Randy, so this is a lower jaw. This is with 2 dental implants. We can change someone's life with 2
Like
dental
just 2 right there.
Absolutely.
Okay.
2 right there. It can snap right in with that. Take a
Very
look.
nice, very nice. So there's snaps that just go right underneath there. And you could use our own denture if you wanted to.
Absolutely. In many cases, Randy, it's so hard for the patient that we have to loosen them up in order for them to get them out.
Okay. So that's 2. What's
That's
the
2.
next level up?
The next level up is with 4 implants.
Okay.
4 implants, you can actually take an existing denture.
So full arch of teeth.
Full arch of teeth, take their existing denture even, and retrofit it to those implants.
More stability.
More stability, more support. But I will tell you, more times than not, we want to make something more aesthetic.
Okay.
Something that's more ideal for them. So we'll oftentimes make a new denture and basically snap into those.
Okay.
Next level up, Randy, is with 4 implants, and they actually screw into the full set of teeth, and they stay in there for life. They're fixed.
Okay.
The next level up beyond that is multiple implants, depending on the size of their jaw, where they actually have porcelain teeth that secure onto those implants, and you can brush them.
And that's a fixed set of teeth also that doesn't come in and out.
Sure is. Sure is.
All porcelain.
All porcelain.
Is it like it's like getting your teeth back?
Absolutely.
Is that right?
It feels like teeth. It doesn't feel like plastic anymore.
They could eat whatever they want.
Everything.
Could they eat a jawbreaker?
I don't usually
seriously.
recommend it even with natural teeth.
But
yeah.
they could eat they could chew ice or whatever, even though
sure
they
could.
wouldn't want to do
They
that.
sure could. They sure could.
So
Absolutely.
it's strong.
Strong as nails. Yeah.
So 60, 70, 80, 90, not too old.
There's no age discrimination at all.
So no more dentures. You're going to wipe out dentures in your town?
I hope so. I
All
hope
right.
so.
All right. So they can go to your website, look at some of the before and afters there. Final message, somebody watching this, a denture wear. They're still worried. They're worried about pain. They're too old. Sounds too good to be true. I don't know.
Okay.
What do you say to them?
I say, come into our office. Let us take a look. Let us talk to you.
Okay.
We'll find out what your options are and see if it's something you want to go with. Because, you know, G.I. Joe used to say, knowing is half the battle.
All right.
And that's all it's about.
Does it cost money to do a consultation for this? Because I know a lot of dentists charge consultations.
Yeah. It costs nothing. Come in. We'll take care of it.
How soon? They walk in the dental office. If everything goes right, how soon before you say, hey, I think we can do it, or we can do it? You're a candidate.
Usually the day that we actually get those x-rays and get those models, that's when we know.
So that's that same day.
It can be.
Well, thank you for coming to the show. Very good.
Thank you, Randy.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like to see this interview again, if you just cut the last 10 minutes, want to see what Dr. Haque has to say, you can go to wellnesshour.com. You can put in Oak Brook, Chicago, and you'll find him there on our website in the search. So just Oak Brook, Chicago, you'll find him there. And of course, you'll probably have it on your website as well. They can see the whole thing there.
Absolutely.
Thanks again. I'm Randy Alvarez. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.